Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoy today's episode. Hello. Thank you again for joining me on the Balanced Momtality Podcast. I love that you choose to put me in your ear and just absorb some of this just basic information, really. It's pelvic floor information, it's women's health information, which is information that we just need to know. We need to be aware of these things that can happen to our bodies and the things that we can do to help prevent them. Aside from medications and surgeries, and honestly, those things have their place, obviously, but there are so many times that these get put at the forefront of our care, and unfortunately, it's not because the providers don't want you to do other conservative things, but those are their tools. Medications, surgeries. If you have a good provider, they are referring you to physical therapy, even if it's not a pelvic floor PT. If you are not getting a referral for physical therapy and you're going in and you're having any kind of pain or after a procedure, these are basic times that we need to be seeing a physical therapist. And it's just not standard of care yet. So again, this is just information that I really think everybody should know so that we can be a better advocate for ourselves. And today, this topic, we're going to talk about prolapse. Prolapse is something that I've talked about in bits and pieces on the podcast, but I really wanted to give an episode on it so that there's a little bit more information out there. So again, you can have more tools because surgery does tend to be one of the first lines of defense that OB-GYNs, urogynecologists, providers go to. This is what they know can fix the issue, but it's not the only thing, and it definitely shouldn't be the first thing. So let's just start off with what is pelvic organ prolapse. So pelvic organ prolapse, or POP, as many of us talk about it, is really, it can be a combination or a variation of different organs, pelvic organs, so the bladder, the uterus, the rectum, this is talking about a female-born body, obviously, falling down. So they're descending, they're losing their structural place and they start to fall down, and in the female body this does show up in the vaginal canal. So it can be a variation of the bladder falling down into the vaginal canal, the uterus falling down into the vaginal canal, or even the rectum falling down into the vaginal canal. But we can also get a rectal prolapse where it's coming out of the rectum itself. And so again, this is kind of scary, right? Who even knew your organs could fall out of your body? Because I'll be honest, I didn't. I didn't know this until I was in PT school going through gender health, and I learned that this was a thing. And I actually have prolapse, and I got it with my first daughter, but I didn't actually know that. I had no idea I had prolapse. I didn't have the symptoms from it. It wasn't until I got COVID a couple years ago and all the coughing and everything that I felt it for the first time. And man, was that humbling, because I definitely did not realize how all-encompassing your mindset gets when you feel your organs falling out of your body, because it's scary. We don't want that. Nobody wants their organs to come out of their body. And this episode isn't here to scare you if you do have prolapse or if you think you have prolapse. In fact, I want this episode to give you hope and empower you, because there are options. And even if you have prolapse, doesn't mean that you can't all of a sudden run or lift heavy or have another child. These are really common fears, and again, for good reason, but I'm here to set the record straight. So pelvic organ prolapse is, again, one of those organs falling down. Many times it's a combination. And what causes this? There are a few things that can lead to this, but the bottom line is that it's an increase in abdominal pressure. There's just too much pressure. So it's shoving and shoving and shoving down on these organs. And through time, all of that extra pressure stretches out the connective tissue that usually anchors these organs to your skeleton. The fascia gets stretched out. And we know fascia cannot contract back up. It's not like muscle. So once it's stretched out, that's kind of where it is. Now, I do have to say, obviously, fascia can remodel. It just takes a long time. So it takes about a year, and that means everything has to be in its perfect ideal place with no extra pressure pushing into that fascia, or it won't heal, which is why many of us never see our fascia heal, because we're always still straining into that stretched out fascia. And so with that fascial drop, those organs start to descend. Now, the pelvic floor does play a big role in supporting the pelvic organs, but not in the way you might think. So it's not sitting underneath all of those organs nice and snug, holding them up high. And so if you get a weak, stretched out pelvic floor, all of a sudden they're low. That's not what's happening. Your pelvic floor is sitting underneath those organs, but those organs are tethered by the ligaments and fascia holding them up. And so the goal and the main role of the pelvic floor in preventing prolapse is that we need to get a preventive engagement. That pelvic floor needs to contract before that moment of increased pressure, because that is what's going to support the muscles, so that even if there's an increase in pressure, those organs are being pushed into the pelvic floor, which is supporting them up high, and it's not just letting those organs squish all the way down onto a resting pelvic floor, because that is just continuing to stretch out that fascia. Whereas if we preventatively engage and contract our pelvic floor, those organs hit a soft wall, if you will, to the point where that fascia and their connective tissue don't stretch. It's not meeting a point of stretch. And so if you don't have that, that is probably the first step, is just starting to check in. Do you have that preventive engagement on a cough or a sneeze or jump or any moment, exercise, right? We need to create that brace. And I've mentioned this in the past episodes. It's called a knack. So the knack is that preventive engagement. You contract before the sneeze, you contract before the cough. And ideally, this is reflexive. It should happen automatically. But for whatever reason, many women, especially through birth, especially a vaginal birth, any trauma, any pain, again, our body just disconnects. And so with that disconnect, we can lose that reflex, but it doesn't mean we can't build it back. So this can become automatic, but we do want to start very consciously making that engagement happen so that we're preventing any prolapse. And if you have prolapse, we definitely want to be engaging so that we can prevent any progression of that prolapse and from that pressure making your prolapse worse. And so that preventative knack engagement is that first tip. But I just want to give you guys, some information about prolapse, because this, in like what it could feel like. What does it feel like when I have prolapse? How do I know if I even have it? Because again, like I said, I had it for 6 years and I didn't even know I did. And so obviously the best thing is to see a pelvic floor PT and get a pelvic assessment, even if you don't have symptoms, because you can still have this condition, but those symptoms might show up differently. So for some people, this feels like a heaviness. It can feel like something's literally falling out of your vagina. It can feel like bulging in the vaginal space. You might actually even feel or see a little bit of bulging tissue in that vaginal opening, hopefully you're not seeing anything coming through that vaginal opening, because then we can pretty much guarantee you have some level of prolapse and it's already progressed a little bit. So we do want to catch things early. That is the biggest tip, to be proactive with prolapse, because none of us want our uterus out of our body or our bladder out of our body. But other signs of this could even be that your tampon goes around a bend, or it feels like it sits weird in the vaginal canal, or maybe when you have a bowel movement, you feel like you have to stick your finger in the vaginal opening or around the perineum or even around the rectum and push. If you feel like you have to we call it splinting. So this is a thing, and don't feel ashamed if you do this, because it's actually good. It's helpful to help shove that tissue back where it needs to go. You're preventing that from stretching further. But this can also just look like leaking. So you can have leaking, but not have any of the heaviness or the bulging or any of those sensations. And then you go get a pelvic assessment and you find out you actually have prolapse, and that the prolapse is what's causing a lot of your leaking. Prolapse can also cause urinary retention, feeling like you're not fully emptying your bladder. So it's, checking in with your body and making sure we're not ignoring these basic signs of pelvic organ prolapse, but then get that internal assessment, especially if you've had a child, because that pressure during delivery can cause a prolapse and cause things to be stretched out. We really want to catch this early. And it's kind of frustrating because I have to be super transparent and honest with all of you here. When I was going through my PT school and pelvic health training to get to treat prolapse, we were taught so differently than we should have, unfortunately. I just went through a really awesome course by Taryn Holm, who's really like the expert in prolapse, and she's from Australia. And if you don't know already, Australia is way ahead of us in most healthcare, but especially women's health. They are like 10 to 20 years ahead of us. And so Taryn Holm, I had the pleasure of getting to learn from her. She came and did a course in America this last month, and it was so eye-opening, and it really changed a lot of how I'm treating now, because unfortunately, there's good and bad news in this episode. Unfortunately, the pelvic floor just really isn't doing as much to support those organs as we originally thought, or as I was originally taught, right? So originally I was told that surgery and pessaries, which I'll mention here in a little bit, are last case resort. We want to get the pelvic floor functioning and doing what it's supposed to do, and teach the pressure management strategies, and all of the symptoms we can get to go away with, just treating what we find. And that's just not fully true. It's not. And even though there's so much truth to that, we can get symptoms to really improve and even resolve in many cases with treating the muscular things we find, the pressure management strategies. And this is crucial for prolapse management. But unfortunately, I was really told that pessaries aren't, what you want to go for right away. And that is not true. So I have really learned differently in this last month going through this course, that a pessary is probably one of the best things you can do if you are an appropriate fit for one. If you have a prolapse and your anatomy would work with a pessary, and you don't have other conditions that might put you at risk with a pessary, so having like a mesh procedure, some of those types of things, it's really beneficial. Having a pessary can really help. And so what is a pessary? A pessary is essentially a silicone or PVC plastic type brace, essentially, that goes internally, vaginally. And what it does is it just provides support. It pushes out into the walls, or basically provides some support within the vaginal canal, so that when that organ, that bladder or the uterus or the rectum, feel that pressure and shift, it's now shifting against a wall instead of shifting into that soft vaginal tissue and stretching. So that wall is really making it so that your prolapse tissue is not stretching further. And this is so helpful. I got fitted for one in this course, and I've been wearing mine, and it has been such a game changer. This was something that originally I did only tell patients to get if we weren't seeing the progress that I wanted to see, or they really wanted to get back into running and they were maybe still feeling a little bit and we just couldn't get it to go away. I was like, well, let's try this. And it would help immediately. And I'm like, well, cool, then use it during exercise, but you don't really have to use it otherwise. Just, you have the pressure management strategies down. Just as long as it's around impact, you should be fine. But that is, while that's still helpful, that's also not what the research is showing. If the sooner we can get a device inside that can hold everything where it needs to be, then the less damage that's done. And in fact, some of the studies are even showing that this is one of the few ways we can actually regress and heal a prolapse. Because if we think about that fascial connective tissue, if it now isn't being stretched out anymore because there's something there stopping the organ from ever moving far enough to stretch that tissue, then it can actually remodel and heal. And so this isn't every case, but this is something that is starting to be seen in the research. It does mean that people, these studies that are showing this, the women are wearing these pessaries every day for 2 to 4 years. So this isn't a quick fix. But imagine you all of a sudden can put something in and not feel like everything's falling out. And so you get to go throughout your day-to-day. Maybe you're not even leaking anymore because there's no sag in that tissue. And then a few years after wearing it, you might take it out and all of a sudden everything's back where it needs to be. Like, I don't know. I think that's pretty cool. And you didn't have to get cut open. And so I am a big fan of pessaries. I think that they are a great tool. They used to be really seen and thought of in more of the elderly population, but the pessaries that we're using now and that I just got trained in fitting are very self-managed. They are soft, they are squishy, you can put them in and take them out on your own, and they can just be such a game changer in getting you back to activity, making you feel comfortable in your body, and all the things. So I am now a huge fan of pessaries, and I think that I'm kind of ashamed and annoyed at myself that all of my patients I had before, I wish I could go back and be like, wait, let's try this pessary. And if you're listening, now come see me. We'll fit you for a pessary. I'm not doing the fittings quite yet. This is mid-May of 2024. So if you're listening to this in real time, I'm waiting for my equipment to come in. But this is a service I'm going to start providing is pessary fittings. But if you're not in the area and you're wondering like, hey, what can I do? I want to see if I have prolapse and maybe I need a pessary. Make an appointment with your OB or your gynecologist, and they will fit you for one. Pelvic PTs are now allowed to fit them in the US, but not everyone is. So you do have to check with the pelvic PTs in your area and see if they are doing pessary fittings. But again, this is a resource that I think everyone needs to know about because unfortunately, when I started talking about this with my grandma, she was like, oh yeah, your great grandma had her uterus all the way out of her body. And I was just like, what? That can happen? That poor thing. Like, let's not be my poor great grandma. Don't let your uterus or your bladder or your rectum fall out of your body. We need to catch these conditions sooner. So especially if you struggle with constipation, and feeling like things are getting stuck in a pocket, they probably are. And having some help with that prolapse can be really helpful. Now, I do have to say that not every prolapse is going to benefit from a pessary. There are some types of prolapse, especially a rectocele, where that rectum is falling into the vaginal canal, or especially if it's falling out of the rectum, that it's probably not going to be very beneficial. If it's super low in the vaginal canal, it's going to be really hard for that internal brace to hold everything in. So you do need to get fitted and just really see if this will work for you. The idea behind the pessary is you should not feel it at all. It's like a tampon. If you feel it, it's not in right, it's not the right size, or it's not going to work for you. So we do have to take certain things into account, like the size of your pelvic floor, the strength of your pelvic floor, how wide the opening is in your pelvic floor where those organs sit, how sensitive and thin or fragile is your vaginal tissue. There's lots of things that do have to be taken into account when deciding if a pessary is right for you. So please don't just all of a sudden go get a pessary, but also make sure that this is or is not the right thing. Go see a provider, go see your gynecologist, go see a pelvic floor PT, and you can ask those questions and get the answers so that you know this is something you can try. Now, obviously with prolapse, it really is pressure management. So especially if you got a surgery, right? You even went under the knife, you got everything tethered back where it needs to go. Unfortunately, these have a super high fail rate because they're not being sent to a pelvic floor PT afterward. It's not standard of care, which I think is so insane, because how sad to go under the knife, get a procedure, have to recover, but not learn how to manage your pressure better. So it fails and you have to do it again and all those symptoms come back. So let's prevent it. And if you've gotten the procedure, let's make sure that lasts for you and make sure you know how to optimize your intra-abdominal pressure, how to engage your pelvic floor, how to make sure that you're moving through your daily functional activities without increasing that pressure, and just optimizing everything throughout your day-to-day. So if you are having these symptoms, please reach out, send me a DM or an email, or find a pelvic PT near you so we can get things sorted out and you can catch this prolapse before it is taking over everything in your mind. Again, come over to the Balanced Momtality Wellness and Support. If you have any other questions, please stay tuned. Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.